So today we'll discuss a case that every pathologist remembers that when they saw this case for the first time. So I saw this case in my first emergency night duty of hematology in the OPD, and this is how the patient presented to me. So I will tell you what was the history given and further what the history was taken. So the history given was a 28-year male with fever and generalized weakness for 2 weeks, and then I saw some suspicious cells in the smear. Because I had a high suspicion from my side, I took the history, and as most people know, pathologists rarely get complete history. So you have to take history from the clinicians. So on further probing of the history, I found that there was gum bleeding episodes and epistasis episodes of the patient in the last 2 weeks, and there was no history of TB contact or blood transfusion, chemotherapy or comorbidities, and there was no significant family history. So with the history given and the history taken, so this is what is the background, and then I analyze the CBC parameters. So in the CBC, what do you see? The normal hemoglobin is definitely about 12, so this is less, which means the patient has severe anemia. And then the normal WBC count is 4,000 to 11,000, please remember this, and this is definitely above it, so the patient has severe leukocytosis. And finally the normal platelet count is, yes, 1,50,000 to 4,50,000, but this is only 22,000, so the patient has thrombocytopenia. So this explains why the patient was having episodes of epistasis and gum bleeding, because there was severe thrombocytopenia. So with this background, let's see the smear. Okay, so here we can see it's a hypercellular, a lot of cells are there, lot of blue looking, purple looking cells in fact. So what do you think? Are they lymphocytes or are they some atypical cells? So let's zoom in, right? A lot of cells, right? Which justifies the 72,000 count. So let's deep dive into this topic. So before going to understand that what is these cells, we should understand the normal cells. So just to highlight, so we will be discussing this cell and this cell. So accordingly, first one is this. So first, this is known as a lymphocyte. So how do I say that this is a lymphocyte? It is a small cell with scant cytoplasm and a dense chromatin. So you know this, and if you see an interesting finding, that the nucleus of this mature lymphocyte is comparable to the size of the RBC. So this is the RBC. Why do I say it's an RBC? Because there is no nucleus, right? RBC is an enucleated cell. So next you got the RBC, you got the lymphocyte, and then you see that there is another cell. So just tell you this is a blast or an immature cell. So how do you compare it with the normal lymphocyte? So your reference range should be the nucleus of a small mature lymphocyte. So that is your reference range to compare any cell in the peripheral smear. So how do I compare? So comparing to this cell, I think it's almost 2.5 to 3.5 times the size of a nucleus of small mature lymphocyte, right? So this is a blast. So we'll further dive into it. Why do I say it's a blast? So there are three major clues. The first one is the cell size, which we already discussed. So this is a small mature lymphocyte again, and this is a blast. So this is definitely more in size compared to the small mature lymphocyte, definitely, and just the nucleus of a small mature lymphocyte, right? So this satisfies the cell size. So the blast should have an increased cell size. So that is done. So that was the first major clue. The next was the nucleus or the chromatin. Can you see here? This is a darker looking dense chromatin, right? Compared to this, can you see this is a bit more lighter, or what you call paler, or in a pathologist point of view, this is a opened up nucleus, right? So now you know the cell size, which is more, the chromatin is again opened up. And just one more point, if you see here closely, the nuclear outline, I can draw it properly, right? So this is a regular nuclear outline. Can you see here? Now I will trace this. Can you see? This is a irregular nuclear outline. So you analyzed the cell size and the nucleus and the chromatin, the outline, everything. So these are your two major clues are done. Why am I telling that this is a blast and this is not, right? So the final clue is the high NC ratio. Can you see that we can still make out a bit of cytoplasm here in the lymphocyte, but here this blast doesn't have any cytoplasm. So how do you mention it? It is a high NC ratio. High NC ratio means nucleus to cytoplasmic ratio. So the blast will have a high nucleus size and then their cytoplasm will be less. So they will have a high NC ratio compared to the others. See here the nucleus size is less and the cytoplasm is decent, right? Even then this will have a normal NC ratio or a low NC ratio, a lymphocyte. So you have three major clues which we satisfied: the cell size, the nucleus, the chromatin, irregular nuclear outline and a high NC ratio. After keeping in mind all these clues, you try to hunt for one important thing, that is, okay, let's say two important things. So can you see something here, the round things inside? I'll just zoom it. Can you see here? There is one here. Here in this slide there are multiple. Here small one, please see, I will just show here. Can you spot here? Yes, there are two, 1 and 2. What about this slide? Here, yes, 1 and 2. Again here 1. So what are these? These are prominent nucleoli. So the blast will always have a prominent nucleoli. The next one, so I will just tell you, this is a case of acute myeloid leukemia. So because it's myeloid, it will have granules. So if you look at the cytoplasm, can you see pink things here? I think here also, so many other, yes, here. So the cytoplasm is granular. That is why this is known as myeloid blast. Plus one interesting finding that you would have spotted by now is this. Can you see a rod here? I'll show. Can you spot it somewhere here in this slide? Okay, can you spot it now? Yes, this again. And granules you can see multiple, and can you spot a very beautiful rod here? So this is an Auer rod, right? So when you find prominent Auer rods and granular cytoplasm, you give a diagnosis of acute myeloid leukemia, and this is an emergency, so you have to diagnose this even if you're a first year, second year, third year, whatever year you are. As a pathology resident, you should know this slide. It's very important, right? So what is the final diagnosis? I've given it away. It is a case of acute myeloid leukemia. And why am I saying? Because the cells are having increased size, they have irregular nuclear outline, opened up chromatin, scant granular cytoplasm, prominent nucleoli, and the diagnostic Auer rod. So I gave a diagnosis of acute myeloid leukemia for that case. So what you have to remember, this is your protocol that you have to remember whenever a case comes. It should be a bigger than lymphocyte, open chromatin, nucleoli, and scan cytoplasm and Auer rod. So I hope this helps, and next time you will remember when a slide which comes with this much cellularity, don't be afraid. You have seen this before, you have seen this in this video, and you will definitely give a diagnosis. So for more such videos, please like, share and subscribe this video. Thank you.